Good morning, how are you? Good. Alright, let's see. I'm just gonna wait till we all get here before we open. You know, we have a new medication that we have to go over, so every time we get a new medication, we just have to go over everything. You know the drill. We'll just wait for more to come. I think we have 2 more, okay? So I'm gonna start working on these. Hi, have a seat. Good morning. Oh, you made it. Good job. Let me just do this last one. Alrighty. Well, good morning, welcome. I appreciate you coming in early. We do have a new medication that we have to go over. So, this is a migraine medication. And our policy is that we have to go over everything before we open so you can be familiar and know what to look for. So I'm just gonna get started, okay? Okay, so these are tablets. They are used to treat migraine headaches in adults that are with or without aura. It works by blocking a protein called CGRP in the nerve endings that are involved in pain and migraines. This helps reduce pain and migraine symptoms. This is from the CGRP inhibitor class of medication and is a prescribed medication only. It is to be used when you have a migraine. It is not to prevent a migraine headache. It did receive an FDA approval back in 2019 for acute treatment of migraines with or without aura in adults. They are available in 100 milligrams and 50 milligram tablets. There are no generics. Its active ingredient is uprogenpent. Some people call this a generic name, but it's not. It's an ingredient that is in the medication. How does it work, you ask? Well, great. Let me tell you. It works by blocking activity in the CGRP. It's a protein that plays a key role in migraine attacks. It is preventing CGRP from triggering inflammation, dilation of blood vessels, and pain in the brain. It helps reduce migraine symptoms such as headache, nausea, sensitivity to light and sound. It is unlike some traditional migraine treatments which constrict the blood vessels. It specifically targets the pathway without causing vascular side effects. Now, what are the side effects to this medication? Although it does say it helps with the symptoms of nausea, it actually can cause nausea and sleeplessness. If they get a serious side effect, like hives, difficulty breathing, swelling of the face, lips, tongue, throat, they need to call the FDA medicine side effect phone number, which that'll be included in their paperwork. Warnings: do not take this medication if you have a history of hypersensitivity to the ingredient Uprogepant, since it's an active ingredient. You should not take it if you're taking known strong CYP3A4 inhibitors, which it will list for them since they don't know, like we know what a CYP3A4 is. It also says to tell them to ask their provider if they're taking these medications, if it's safe to take this migraine medication. Make sure that they tell their doctor what medications they are on, which I'm pretty sure they did, but you just never know. Because sometimes they don't see their PCP, they see a migraine specialist, a neurologist, and they just don't tell them. I don't know. Before taking this medication, many drugs can interact with this and have dangerous side effects. Some drugs should not be taken together with this medication. Your doctor may change treatment plan if you also use a certain antibiotic like clarithromycin, an antifungal medication like ketoconazole, antiviral medicine to treat HIV or AIDS. This list of medications will be listed in the paperwork that we include with them, but on our system it should beep and show you if they are taking any of these medications. You want to make sure that the medicine is safe for them, so make sure to tell them if they have liver disease or kidney disease. We need to ask them. Like I said, if they're not seeing their primary care doctor or they're seeing a kidney doctor, when they go to the migraine doctor, they just might not tell them. So we just want to remind them it is not approved for anyone under 18. Once again, that should pop up if there's a red flag. Pregnancy: tell your doctor if you're pregnant or want to become pregnant. It's not known whether this medication will harm an unborn baby. However, having migraine headaches during pregnancy may cause complications as diabetes and eclampsia, dangerous high blood pressure that can lead to medical problems both for the mother and the baby. The benefit of treating migraines may outweigh the risk of the baby. So, breastfeeding: it may not be safe to breastfeed while taking this medication. Ask the doctor. Once again, our systems will alert us if we have information that they just gave birth. Who should take this medication? They should take it exactly how the doctor prescribed, obviously, for migraines. How should they take it? They should follow instructions on the prescription label and read all medication guides. Or instruction sheet to use the medication. So make sure you tell them to read their pamphlet. You may take this medicine with or without food, which is great, but they need to avoid grapefruit and grapefruit juice. after taking this medication, if their headache is not completely gone away or it comes back, they may take a second tablet. It has to be at least 2 hours since your first dose. If their symptoms do not improve, tell their doctor so they can take it. And if they still have a migraine, after 2 hours, they could take another one. Or if their headache went away and then 2 hours later it came back, or 4 hours or 6 hours, they can take another one. They should not take a second tablet within 24 hours if they did eat grapefruit or take any of these medications. 1, 2, 3, 4, 5. There's 5 listed. They need to call their doctor and let them know if they have 8 headaches or more in 30 days. They need to tell their doctor if the medicine seems to stop working, as well as treating attacks, migraine attacks. The cost of this new medication varies on insurance plans and pharmacy you use. So this pharmacy I've seen, or it's basically free, so it is covered if they come to this pharmacy with any insurance. The dosing, it comes in 50 milligrams and 100 milligrams. They cannot take more than 200 milligrams in 24 hours. The safety of treating more than 8 migraines in a 30-day period is unknown. So make sure to remind them. That will be highlighted in our system, that you tell them to not take more than 8 pills in a month. If they miss a dose, they can't, because it only happens. You only take it when you get a migraine. It's not a daily thing. It's not preventative. If they do accidentally overdose, they need to call the emergency medical attention poison hotline, which will be included in their pamphlet. They're really pumping out. Do not. It says what to avoid. Grapefruit may interact with this medication and cause side effects. Do not eat or drink grapefruit juice. Our pharmacy is great at that, because we are going to put little stickers on it with the grapefruit and an X and say, do not eat or drink grapefruit. It's not safe to take with 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, with 15 medications, which our symptoms will pop up if they are taking it, and it'll also be in their pamphlet. Once again, make sure they read the pamphlet. The packaging of this medication, not only do we include our pharmacy pamphlet, but the packaging, it comes in a box. They're going to insert their own packet, so it's everywhere. They need to store it at room temperature between 68 and 77 degrees. Let's see, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. There's 11 interactions, which most people don't take these. The only one that might be common that they take is vitamin E. They should not take this migraine medication if they are on vitamin E. They need to stop vitamin E, or don't try these pills. in Chicago, Illinois. No, compared to no pricing, reviews, drug images, dosage, patient tips, trained party support groups, approval, breastfeeding in Espanol, treatment, prescribing, kind of, let's see what, well, it actually has, there's 265 reviews about this medication. Just for us to know, it has a rating of 6.4 over 10%. 6.4 out of 10. 59% of viewers reported a positive experience, while 35 reported a negative experience. As for me and myself, I did try this medication and it did not work. Didn't work at all. I took it when I had a mean migraine, and it seemed to relieve maybe about 15%. I took it while I felt a migraine. I didn't. I took a second pill, didn't help. But it, I had to take it until I got a new prescription for something else. And for me, this medication did not work at all. But for 50% of people, it did. I just happened to be in the other that it didn't. Common side effects that the patients, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9. Yeah, I had 10 common side effects, which is more than what the drug company said. The common side effects were nausea, dizziness, tiredness, drowsiness, vomiting, sleepy, headaches, upset stomach, fatigue, and brain fog. I can't say it did not make me sleepy. It did not make me drowsy. Thank God I didn't vomit. I guess a headache, because a migraine and a headache are two different things. It upset my stomach a little bit, but not really. I just felt weird. I guess that would be the brain fog. I felt like lightheaded, I guess you would say. I don't know. It was just weird. But yeah. Do you have any questions for me? No. It is not a narcotic. No. Let's see. Does it help relieve pain that occur with migraine headaches? It said it's supposed to relieve symptoms like light sensitivity, sound sensitivity, and nausea. Yeah, that's it. Let's see what the bottom line is. It is not a narcotic. It is not a preventative medication. So basically, it's an supposedly anti-inflammatory, just for the receptors of your neck area to your brain. It won't help with like arthritis, or it won't help with the skull inflammation. It's the neck. Yeah. Alright, well, thank you guys for coming in in a little bit early so we could discuss this medication. I am thankful for all of you that really have a calling for this position and care for our patients and want to be updated. It's so great that we live in a small town and that we are a smaller pharmacy so we can have that interaction with our patients and really be informed of what medication